Doctor, you mentioned on direct examination gastrectasis. Yes, gastrectasis, or dilatation of the stomach. And was there also a condition of gastroenterostomy? Yes, gastroenterostomy, or the formation of a passage between the stomach and the intestines. Doctor, what does gastrointestinal refer to? Gastrointestinal refers to the intestine. It pertains to the stomach and the intestines. What is glycemia, doctor? Glycemia is sugar in the blood. And glycosuria? Glycosuria is sugar in the urine. Doctor, what is hematemesis? Hematemesis is vomiting of blood. And a hematoma is what? It is a blood tumor. Is it different from hemophilia? Yes, it is. What is the difference? Hemophilia is an inability of the blood to coagulate. What is a hepatic flexure, doctor? Well, hepatic refers to the liver. It is the right bend of the colon under the liver. And hepatitis? Hepatitis is simply the inflammation of the liver. And hepatolysis? Hepatolysis is the destruction of liver cells. Doctor, what is a hysterectomy? A hysterectomy is an excision of the uterus. And the hysteropexy is what? The hysteropexy is the abdominal fixation of the uterus or suspension of the uterus. Doctor, is there a difference between the two iliums? Yes, there is. What is the difference in spelling? One is with an I, one is with an E. And the ileum with the E is what? That is the third part of the small intestine. Ileocecal valve refers to what? It refers to the two lips or folds at opening between the ileum and the cecum. And that is an ileocecal valve? That is correct. It is one leaf of a double door. What is ileostomy, doctor? Ileostomy is the creation of an opening through the abdomen into the ileum with an E. And an ileum with an I is what? An ileum with an I is the wide upper part of the hip bone. It is a bone, it is a bone. And iliofemoral? Iliofemoral refers to the ilium and the femur. And iliosacral? Iliosacral pertains to the ilium, again with an I, and the sacrum. What is leukemia, doctor? Leukemia is a disease characterized by an extremely high white count. And leukocytosis? Leukocytosis is an excessive increase in the number of leukocytes. What is leukopenia, doctor? Leukopenia is an abnormal decrease in number of leukocytes. Doctor, the excision of fatty fissures, or tissues rather, is called what? That is a lipectomy. A lipectomy? A lipectomy. That is what? That is an excision of fatty tissues. And lipemia? Lipemia is fat in the blood. Lipiodol? Lipiodol is an opaque oil used for injection into the body cavities for purposes of radiographic examination. Doctor, finally, you mentioned in your hospital record lithiasis. Yes, lithiasis, or the presence of stone or concretion. And a stone is what? It is called a lithocystotomy. A lithocystotomy? A lithocystotomy, which is an incision into the bladder to remove the calculus or stone. Doctor, what is a lithoscope? A lithoscope is an instrument for examining stone in the bladder. Stone in the bladder? That is correct. Related to what? Related to meninges. And meningeal is related to meninges? That is correct. So meningitis is what? It is an inflammation of the membranes of the spinal cord and brain. And meningioma is what? That is a tumor of the meninges. And meningococcus or more than one meningococci are the microorganisms responsible for meningitis. Doctor, what is metritis? Metritis is an inflammation of the uterine musculature. And hemorrhagia? Hemorrhagia is a bleeding from the uterus. And metrorrhagia? Well, I think you mean metrorrhexis, and metrorrhexis is a rupture of the uterus. Doctor, you mentioned myelitis. Yes, myelitis. It is an inflammation of the spinal cord or of the bone marrow. And myelogenous is the originating in the marrow. Myelosarcoma is a malignant tumor of the bone marrow. Doctor, what is myitis? Myitis, sometimes called myositis, is an inflammation of a muscle. And myocardium refers to the heart muscle. Nephropexy is a surgical attachment of a floating kidney. And nephrosclerosis is a hardening of the kidney. Nephrosis is a condition marked by degeneration of the renal substance. Doctor, let me ask you this. Ophthalmology is, of course, refers to the eye. Yes, science of the eye and its diseases. What is osteoclasis? Osteoclasis is the surgical fracture of a bone to remedy a deformity. Osteoma is a bony tumor. And osteomalacia is a softening of the bone. Doctor, what is pneumococcus? It is the microorganism causing pneumonia and other diseases. And pneumonia is defined as what? Pneumonia is the inflammation of the lungs with consolidation and exudation. Is there an introduction of air into the pleural cavity? Well, that is called pneumothorax. And pneumoperitoneum is the introduction of air into the peritoneal cavity. Doctor, what is proctology? Well, it is the medical specialty dealing with diseases of the rectum, not called that anymore. What is it called, doctor? Well, it is referred to by other terminology rather than proctology. And proctoscopy is the instrumental examination of the rectum. And proctopexy is the suture of the rectum to some other part. Doctor, what is psychiatry? Psychiatry is the medical specialty treating mental and neurotic disorders. And psychoneurosis is a functional disorder of mental origin within or without the neurotic disorders that usually accompany it. Doctor, finally, pyelitis. Pyelitis is inflammation of the pelvis of the kidney. I ought to bring this back because this stopwatch stopped after the first 2 seconds. And it's sitting here, so I'm not handling it at all.
I see it. Well, you touched it to, if you touch it on...
well, I started it and put it down.
But, if you touch it in a, what's the word I'm looking for? A weak way, and you sort of go like this, like you do, then you're accidentally pressing it twice. That's what it's not a mechanical failure, it's a user failure. It's good.